Nearly 80% of adults over the age of 60 will experience persistent lower back pain. But what's surprising is this. Recent clinical findings suggest that the pain itself is rarely the real problem. What most people over 60 don't realize is that back pain often comes from hidden changes inside the body. Changes in blood flow, muscle activity, nerve sensitivity, and even hormone levels. And here's the part many patients never hear during a routine doctor visit. Most chronic back pain after 60 is not caused by damage. It's caused by systems inside the body slowly shutting down their ability to recover. Once you understand what's really happening beneath the surface, something important becomes clear. Many people continue living with back pain not because it's unavoidable, but because they're treating the wrong problem. Let's break down what spine specialists are now focusing on and what could quietly make the difference between years of discomfort and regaining control of your mobility. Most people think back pain begins with bones or discs, but here's what spine specialists are now focusing on: circulation. After age 60, blood flow to the spine naturally begins to decline. This happens because the tiny blood vessels that feed spinal tissues, called capillaries, become narrower and less efficient over time. And when circulation slows, three things happen. Nutrients reach spinal discs more slowly. Waste products accumulate in tissues. Inflammation lingers longer than it should. Over time, this creates the perfect environment for chronic stiffness and pain. But this is where most people go wrong. They try to rest their back as much as possible. Unfortunately, too much rest makes circulation worse. Movement is actually what pumps nutrients into spinal tissues. Even gentle daily movement, walking, stretching, or light mobility exercises helps restore the natural fluid exchange inside spinal discs. And when circulation improves, pain signals often decrease naturally. But circulation is only part of the story, because something else begins changing quietly after age 60. If you look at MRI scans of adults over 60, doctors often notice a pattern. The muscles that support the spine, particularly the multifidus and erector spinae muscles, begin to shrink. This condition is known as age-related muscle atrophy, and it doesn't happen suddenly. It happens gradually over years. What most people over 60 don't realize is that spinal stability depends far more on muscles than bones. When these deep, stabilizing muscles weaken, the spine becomes less supported, small joints carry more stress, nerves become more sensitive to pressure. This is why many people say their back goes out doing something simple, like reaching or bending. It's rarely a structural failure. It's usually a muscle coordination failure. But here's the encouraging part. Research shows that even people in their 70s and 80s can rebuild spinal muscle strength. Spine specialists now recommend gentle core activation exercises such as pelvic tilts, modified bird dog movements, wall-supported squats, slow walking with upright posture. These exercises reactivate muscles that have simply gone dormant over time. But if weakness continues long enough, another issue can appear, and this one involves the nervous system. Here's something fascinating. Pain doesn't always reflect damage. It reflects how sensitive your nervous system becomes to signals. Recent neurological research suggests that after age 60, the body's pain processing system becomes more reactive. This means the brain can interpret even small mechanical stresses as larger pain signals. This process is called central sensitization. But this is where it gets more serious. Chronic inflammation can amplify this sensitivity. Inflammation often increases because of reduced physical activity, poor sleep quality, blood sugar fluctuations, chronic stress. When inflammation stays elevated, nerves surrounding the spine can become irritated and hypersensitive. This creates the feeling many people describe as deep aching, burning sensations, persistent stiffness. The key is reducing inflammatory triggers. That includes simple changes such as improving sleep consistency, walking daily for circulation, increasing anti-inflammatory foods. Foods rich in omega-3 fatty acids, magnesium, and antioxidants support nerve health and recovery. But there's another factor that few people connect to back pain, and it becomes increasingly important after 60. Hormones influence far more than people realize. After age 60, levels of testosterone, estrogen, and growth hormone naturally decline. These hormones play an important role in muscle maintenance, tissue repair, collagen production, joint lubrication. When hormone levels drop, recovery slows. This means that small strains or micro-injuries in spinal tissues take longer to heal. Over time, repeated minor stress can accumulate into persistent discomfort. But this changes everything after age 60. Recovery becomes more important than intensity. Instead of aggressive exercise routines, spine specialists recommend consistent low-impact movement, strength training 2 to 3 times per week, adequate protein intake, sunlight exposure for vitamin D production. These strategies help support the body's natural repair systems, and when those systems improve, many people notice a gradual reduction in chronic pain. But there's another common mistake that quietly worsens back problems. Modern lifestyles involve a surprising amount of sitting: television, computers, reading, driving. But prolonged sitting places significant pressure on the lower spine. In fact, spinal disc pressure while sitting can be up to 40% higher than when standing. Over time, this leads to tight hip flexor muscles, weak glute muscles, reduced spinal mobility. If you ignore this, here's what happens. The pelvis gradually tilts forward, the lower spine compensates, and small spinal joints begin absorbing stress they were never designed to handle. Spine specialists now recommend something surprisingly simple: movement breaks every 30 to 40 minutes. Even standing for 1 minute can restore circulation and reduce disc pressure. Small habits repeated daily often create the largest long-term improvements. But there is one final factor many people underestimate, and it may be the most important of all. The body repairs itself primarily during deep sleep. But sleep quality often declines after age 60, and when sleep becomes fragmented, several things happen. Muscle recovery slows, inflammation rises, pain sensitivity increases. Many people notice their back pain feels worse in the morning. This is often linked to poor overnight recovery. Improving sleep environment can make a measurable difference. Spine specialists often suggest maintaining consistent sleep schedules, using supportive mattresses and pillows, limiting caffeine later in the day, gentle stretching before bedtime. These adjustments support the body's natural repair cycles, and when recovery improves, pain gradually becomes easier to manage. Living with back pain can be deeply frustrating, especially when it limits simple things: walking comfortably, enjoying time with family, or feeling confident in your own body. But here's the important truth. Back pain after 60 is not always a sign that your body is failing. Very often, it's a signal that certain systems need support, movement, and recovery. Circulation, muscle strength, inflammation balance, hormonal health, sleep. When these systems improve, even gradually, the spine often responds in remarkable ways. Mobility returns, pain decreases, confidence grows, and many people rediscover the ability to move freely again. If you found this information helpful, consider subscribing for more evidence-based health insights designed specifically for adults over 60. Because the right knowledge, applied consistently, can make the years ahead stronger, healthier, and far more active than most people expect.